I'm not very articulate like my husband, but I'm as popular as the tax collector. Sorry. But my name is Belinda Berneski, and I am a registered dental hygienist. I have been in dentistry for over 30 years. And I love my profession. And I have seen so many great things, as far as health of the body and of the mouth. Oral health is what we say to people, healthy mouth, healthy body. So today, I'll probably read a lot, but let me put on my glasses. 30 years I've been in practice. I have to wear these glasses, so. Okay, so my patient, my husband, poor man, but he does put up with me, which I'm, kind of works both ways. So I am concerned with every aspect of his health, including his oral health. There's three things I want to talk to you tonight about. It's diabetes, dentistry, and my husband. Like I said, I've been in this field for over 30 years, and I've seen many problems in people's mouths. I've seen oral cancer, autoimmune diseases, decay, and periodontal disease. Some of these diseases are manifested in the mouth before my patient is even aware that they have this problem. A lot of the times there is no associated pain, and diabetes is one of them. Diabetes strikes many people of all ages and is becoming more prevalent today in all societies. Diabetes is due to either the pancreas not producing enough insulin, or because cells of the body do not respond properly to the insulin that is produced. While the pancreas is affected, it also affects other organs. It causes damage and, as Dr. Scott said, an inflammatory response in the body as a balance is trying to be achieved. As reported by Wikipedia, untreated diabetes can cause many long-term complications to include, but not limited to, heart disease, kidney failure, damage to limbs and the eyes. Globally, as of 2013, an estimated 382 million people have diabetes, with type 2 making up 90% of the cases in both men and women. Diabetes resulted in 1.4 million deaths worldwide, making it the 8th leading cause of death. This is something we need to control. As Salinar has said, we need to save the world. That's a lot of people that are suffering with this disease. So, what does diabetes mean to a dental patient, like my husband? Due to the inflammatory response of the body, the patient struggles with periodontal disease. Periodontal disease is one of the most common diseases of the mouth. At this time, all we can do as dental professionals is maintain the patient in their present state so the disease doesn't progress. As a hygienist, there are criteria to determine if someone has this disease, meaning periodontal disease. I look at the tissues in the mouth and observe if they are red or purple, swollen, and bleed easily. I hope this doesn't gross you out too much. This is really cool to me. I measure gum tissue around each tooth. The measurement of 4 millimeters or greater and bleeding is an indicator of periodontal disease. Billions of bacteria in the mouth causes an inflammatory response and tissue swell. As the bacteria go deeper in the pockets around the tooth, it destroys the tissue attachment. The attachment is gone and the bacteria head for the bone. The bone holds the teeth in the socket. I think you can see where I'm going with this. And eventually the tooth, or all the teeth, are lost. This is the progression of periodontal disease. I'm not here to talk about periodontal disease, even though I do enjoy it. As a hygienist, I treat this disease by dividing the mouth into sections or quadrants to work on. I anesthetize the patient. I get him numb. I get him numb. A quadrant or two at a time, I perform a non-surgical deep scaling and replaning. This is to remove hard deposits and irrigate the tissue of the billions of bacteria. If you have ever had this done, you know this isn't a walk in the park or a lot of fun. Sometimes I see great tissue response and people have this non-surgical procedure done and the tissues start to heal and reattach to the teeth. This is our goal as a hygienist. This is what we want to see. However, a person with diabetes struggles to get this response as they are always trying to maintain balance throughout the body. And if not controlled, the tissues cannot heal quickly, and sometimes very little response is noted. In 2004, I noticed a change in my husband's oral health. The tissues were red and edematous, meaning they bled a lot. The pocketing around each tooth had gone from a healthy 2 to 3 millimeters to 4 to 7 millimeters with moderate bleeding. His breath was sweet smelling. I called his general practitioner and I requested an A1C blood test be done. At that time, it was determined he had type 2 diabetes. He was put on metformin, and a non-surgical scaling and replaning was done with anesthesia. I did want to be kind to him. I did get him numb. So, he had good response, but every 3 months he had to return for maintenance. In January 2011, he started taking ultra-reactive. As time progressed, his tissues regained the pink, healthy hue and was firm to the touch. No bleeding. His pocketing is now minimal, and he now only comes in twice a year for regular cleanings, as maintenance is no longer required. That's amazing. It is absolutely amazing. Well, much to his hygienist's dismay, his home care is not the best. He still only brushes once a day and he's not flossing. He is the typical patient. He is the typical patient. So, he continues to improve. I can't understand why, but he is still improving. Well, as I would like to give myself some credit, I don't think I can. This improvement is not normal for people with diabetes. And the only change now is that he's taking ultra-reactive. If this is helping with the inflammatory response in the mouth, I can see it working in the rest of his body, dealing with the inflammatory response. People come up to him and ask him, what has he done? He's lost 105 pounds. He looks healthy. His skin is firm and young looking. Well, he always looks young. His doctor tells him he is stable. He's stable. I just want to shout hallelujah. Okay? He's stable. All right. So as a dental professional, I'm ending this. As a dental professional, I can tell you what I have seen and believe ultra-reactive is a great product to help people reach overall health and the control of diabetes.